We were just overwhelmed and astonished by the severity of COVID and then by the numbers that we started to see. At one point, our 23-bed ICU took the entire second floor over. We had 39 COVID patients here, all very, very sick. It's been a humbling experience, to say the least. We actually started very early with monoclonals. We started it in a scientific way. We looked at not only outpatients who had COVID, but also inpatients that were very sick with COVID. Then we sort of expanded our access, and our hospital actually started to give monoclonal antibodies under emergency use authorization to people outside of clinical trials. You need to get patients early on before the virus really takes hold. 10 days or less of symptoms, a positive test within 3 days. Those are things that have been really important in figuring out what population of patients and who should sort of be given these antibodies. I think we can say there's a significant decrease in your risk of going to the ER with your COVID, being admitted to the hospital with your COVID. And as the trial data really emerges, we hope that it also means that it will decrease the risk of developing severe COVID. We're still seeing patients who are coming in very, very ill from COVID. All of our patients come from Orange County or come from Lancaster or Apple Valley or Whittier. So that's been the biggest driver for me in COVID, the disparities, the access to care, the access to treatment, the fact that so many of our patients are in remote or socially disenfranchised or geographically disenfranchised areas and don't get access to these treatments in the same way that people in adjacent to big academic medical centers can get them. I think we're moving into more of a patient-engaged research model where clinical research becomes a treatment option, and it has to be a treatment option, not just for the select few that have internet and can find out about these trials and advocate for themselves, but for everybody. And what that is going to take a lot of education. It's going to take a lot of thought leaders and trying to figure out how to level the playing field. Because clearly that's a challenge for our generation, for my daughter's generation, to make healthcare equitable. Research should be a treatment option for people. They should be educated to know what it's about. They should have the chance to consider it, especially for their seriously ill family members or for themselves.